Professor Mahmud Raji, the Chief Medical Director of the National Hospital Abuja, admits that despite being a physician, he had never considered glaucoma a serious disease until March 12, 2024. Ophthalmologists at the National Hospital Abuja, in commemoration of World Glaucoma Week 2024, had organized an event to discuss the devastating effects of glaucoma. The theme for this year was Uniting for a Glaucoma-Free World.
That tells you that the information out there is not really adequate enough to get round. If medical people or health personnel are not fully aware. So it now gives us that opportunity now to say we have to look for ways to really pass this message out there to not only medical staff to know, but to reach out to the people living within cities, within villages, to really get to know what this problem is. But that also tells you that it's a Herculean task for you to reach out to the people that stay in those villages. Because for people who stay within towns, once they have one or two issues that can bring them all, they can come, and then by then it may be detected. How about those people living in those villages?
According to a publication by the National Library of Medicine, glaucoma is nicknamed silent thief of sight due to its predominantly asymptomatic nature throughout much of its progression. Symptoms typically manifest only in the later stages of the disease. Globally, glaucoma accounts for approximately 11% of irreversible vision loss in adults aged 50 and above. In Nigeria, the prevalence of glaucoma stands at 5%, with a staggering 94% of affected individuals remaining undiagnosed or untreated. Alarmingly, many patients arrive at clinics already suffering from blindness due to glaucoma. Despite its significant impact, awareness about this disease remains low.
Yes, the World Glaucoma Week is celebrated worldwide to create awareness, essentially, for this very debilitating illness called glaucoma, which causes permanent visual loss that is irreversible. So any information that is passed around the world or around the community where people live, they should be enlightened, they should be informed about this illness, that once identified, the patient or the individual is no longer at severe risk of getting blind. If you do not know, you don't have any information, then the tendency is you may have a disease that is symptomless, that doesn't have any warning sign until the vision is completely gone. Thereafter, blindness sets in, and then there's nothing one can do to reverse that blindness. So if there is any forum like today where we celebrate this World Glaucoma Week to create awareness and identify people who need help, is a worthwhile exercise.
Said the eye does not burst like the pipe, so it damages the part that connects the eye to the brain, which is the optic nerve head. So that is the basic principle. Now, I have told you that glaucoma doesn't cause any problem, any pain, especially the open angle type. Nobody knows there's anything happening until a lot of damage has been caused. So why do we want to wait till that time? It is because we don't want people to go through that we are saying, come on time. We know that it runs in families. There are many risk factors that are associated with glaucoma. Like I said, family history, people who wear glasses, injuries to the eyes, and the unfortunate one is that the fact that you are an African, you are a black man, and you are 40 years and above, you can have glaucoma. Isn't that is unfortunate? It is worse that you are 40 years and above, yeah, but that you are black, it's likely to come even much earlier because we are blacks. It's associated with the Negroid race. Yes.
Mrs. Nkechinyere Ihunweze first became aware of her condition when she experienced short-sightedness, leading her to seek medical attention over 10 years ago. She was subsequently diagnosed with glaucoma and has since been diligently following her medication regimen to prevent the progression of the disease.
My advice is, one, to always check with the professionals. So you come to the hospital, that's one. Two, if you are diagnosed of something, you don't deny it. You accept it and then ask what to do. Because if you are saying, God forbid, when the doctor told me this eye drop is like lifetime something to maintain the eye pressure, I didn't deny it. I said, okay, you understand. So you don't live in denial, you accept the fact and then work with the doctors. So when you do that, if it's dictated early, that's the most important thing. Don't stay at home. You go to the hospital, meet the professionals, they tell you what to do, then you follow up.
To expand the coverage of the free eye screening exercise organized by the Department of Ophthalmology at the National Hospital Abuja, Dr. Habibat Darumosu led her colleagues to Mararaba Medical Center.
We are commemorating the World Glaucoma Week, which is an event that is holding globally. The World Glaucoma Week is usually a screening exercise targeted to be able to catch glaucoma patients early, because the key thing is to be able to catch them early enough to institute some form of treatment that will prevent blindness. This outreach helps us to give back to the community. We're able to meet a large number of people. We have come to their community to be able to screen them. Many a time, patients from these localities or areas do not have access to the kind of services we offer. So this helps us to give back to the community. We are able to get a large number of people in their bases, and we're able to screen them and give appropriate advices.
A regular eye test can help detect eye conditions before you notice the effects on your eyesight. Early treatment can often prevent your sight from getting worse. So, are you one of the 20 people in our country with undiagnosed glaucoma? Get an eye test today.